Welcome to or welcome back to Lisa Maas Medicare. I do everything Medicare. Now, I don't work for the federal government. I don't work for the Office of Medicare. I am a licensed agent and actually a broker. So, what that means is I'm licensed with all the different insurance companies in my area. In fact, 7 out of the 8 companies I'm licensed with, and have the ability to write 23 out of the 24 plans. So I really give people choices of what they want to do with their health insurance. So I'm an advocate. I sit down with you one-on-one personally, either on the phone, or we can do it in person, or we can do it on Zoom and look at all your choices. And I know I keep saying this every week, but it's really important this next year coming up in 2025. We have a lot of changes. In fact, about 30,000 people in southern Idaho will lose their policies because the insurance company decided they don't want to renew that particular Medicare Advantage policy. So it's really important that you get in touch with myself or your local rep. If you're in a different region, I can find you somebody. You can call me. Here, I'll put my number up on the screen. It's 208-544-5011. You can also email me through the website of insuranceover65.com. Now, if you have any kind of Medicare questions, of course, you can always call me or email me, but you can also, there's a huge body of work on Insurance Over 65 website. Just go into the articles and you can read anything you pretty much want to find out about Medicare. The basics are there located in the articles. And also these YouTube channels or each weekly programs that I do are also recorded. You just have to go into the live section of Lisa Maas Medicare. And again, there's a whole body of work there for you to look at and to listen to. If you're on the call today and you have any questions, feel free to write them in the chat, in the comments, and I'm happy to answer them. So today we're going to talk about Part B. Are you wasting money on Part B? So remember, when you first sign up, or if you're aging into 65 now and are about to sign up, you sign up for A and B. Think of A as your inpatient, your hospitalization, B as your outpatient or your doctors. Part A generally isn't a cost. Part B, there's a cost. This year in 2024 of $174.70. Next year, it'll go up about $10 to about $184. So that cost, are you wasting your money on that or not? So Part B covers all your doctor's visits. It covers your outpatient care. It covers your home health services, which a lot of my clients now are utilizing that, where their doctor's sending the nurses into the home. And I work pretty extensively with the home health nurses to help any of you that can't get out of your home. You can always call me. I can come over and revisit your policy and see if there's anything that I can do. Also, Part B covers your durable medical equipment, things like walkers, crutches, hospital beds, things of that sort, and any of your preventative services. There's a whole litany of preventative services, from mammograms to glaucoma testing to diabetes testing, that are included with your Medicare. So let's talk first about not throwing money away. Those of you that have Part B, you're not throwing your money away at all. First is, if you've already retired at 65 and you're retired, if you don't have Part A and B or any other type of health insurance through a company, then you're going to get dinged over time. They're going to send you into, like, you'll have some monthly fees that you'll have to pay if you don't have Part B. So if you're not working at 65, it behooves you to sign up for A, sign up for B. Remember, that covers 80%. And then that other 20%, you can either do option one as a supplemental and a standalone drug policy, or you can bundle it all together in what's called Part C, or Medicare Advantage. So if you are not working and you're over 65, then you're not wasting money on having Part B. The next is Cobra. Your Cobra is eventually going to run out, so you're going to want to sign up for A and B. In our town in Southern Idaho, it can take up to 2 to 3 months to get that activated because we're a little bit behind here. There's a couple of ways to sign up for Part B. The easiest way is to do it online, ssa.gov. And you can do that online. You can call them directly. That's probably the worst. You might be on hold for quite a long time. Or you can go into your Social Security office. And the last is you can call me and I'll come over and I'll help you and we'll do it online. If you do it online, you're going to need a computer or a cell phone because you're going to need an email address for them to verify that you are who you say you are. The next of not wasting money is if you work for a small company and you continue to work past 65 and there's less than 20 employees. So there's 19 or less employees because Medicare pays, but it pays as a secondary of that 20%. So if you have a small company, your company, Medicare will pay, and then you're responsible for paying the 20%, and then the company kicks in. So it really behooves you to have A and B if you work for a small company and you're still working over 65. The other is if your insurance for your company isn't as good or better of what Medicare offers. Now, that's not a big deal this year, but next year, the policies are changing, and then Congress said that you're not going to pay, you the consumer, more than $2,000 out of your pocket for drugs. Now, are the small companies going to adjust their insurance to be the same? If they don't have that and they're not included in that, then your insurance isn't going to be, you may get some problems coming up. So just double check that your company, if you're working with a small company, has the same or better insurance than what Medicare can offer. Okay, so any of those, you're not throwing your money away. Let's go to a comment real quick. This came in from Dr. Gary Daniel, and it says, what if I'm losing my plan next year? What do I do? Will my coverage lapse happen? Well, what you do is when you say losing your plan, those of you that have supplemental plans, you're not going to be losing your plans. As long as you pay your payment, you will have your plan. It's the drug plans that are going to be affected, and also the Medicare Advantage plans that are going to be effective. In September, it's required by law for your insurance company to send you a letter. It's called an ANOC letter, annual notice of change letter. They will let you know if you're going to lose your policy and or what's changing on your policy. We know there's always changes every year. Are they big changes or are they small changes and you just want to renew? If you do nothing and your plan just has small changes, it'll just automatically renew. If you're losing your plan, call me. October 15th through December 7th, we can review all the different plans. I know one carrier is just pulling out of this area. They're not going to offer their plans. But remember, if you're on a Medicare Advantage plan, like in my region, there's 23 different choices to choose from. I know several of the companies are not offering the PPO that they were offering, but they have another PPO. So we can just switch you to a different plan. So it's not that big a deal. What we have to do, though, is sit down either on the phone, on Zoom, or in person and look at your choices. What are you looking for? Do you need dental this year? Do you need some extra glasses this year? Are you going in and having an operation, so you want to make sure your co-pays are smaller? And then on your drugs, my company, my back office is called Spark. Any of you that are my clients, they will send you something in the mail that you can update your doctors, you can update your prescription drugs, and we'll take a look at all your prescription drugs and find out the best formulary and the best, the one that works best for you, I should say. and then you choose what works best for you. So there's a lot coming up. There's a lot in the hopper. It's actually going to be good for some people. They may even make better changes for themselves. It's just important to contact me between October 15th and December 7th. Do not wait till December 7th, though. October, November is the best time to do that. Good question, Gary. Thank you so much for that. All right, so let's get into, are you throwing your money away for Part B? Well, these three you are. The first one is if you are still continuing to work past 65 and you work for a large company that's 20 or more employees, and they have comprehensive employer coverage the same or better as Medicare. Most everybody does. They pay first, Part B pays second. So if you're paying less than about $250 a month for your coverage with your large employer, you're probably better off staying with your large employer until you retire. Give me about 2 to 3 months prior to your retiring and call me. And then we'll look at, when you do retire, what your choices are. If you have PERSI that comes in, we can look at that. That's when you work for like the local government in your region, like ours is called PERSI, they'll give you money to put towards Part B or towards your supplemental or your Medicare Advantage policy. So we'll look at all that. Those of you that are in the railroad, we can look at that. And those of you that are retiring from federal employee health benefits, we'll look at that. A lot of times your FEHB, your federal employee health benefits, you're better off going that direction than you would be with a Medicare Advantage plan. You want to weigh those out. So if you're continuing to work, you have a large company with comprehensive employer coverage, there's more than 20 people that work in that company. If you're paying more than $250, call me, let's sit down and let's weigh things out. If you're paying less than $250, then just sign up for Part A. Do not sign up for Part B. Part A, you want to get your A and B going. So sign up for A if you're with a large employer, and then 3 months before you retire, call me and we'll get you set up for B, and then go to the next level of filling in that 20% gap. The other is the VA benefits. Now there's 4 different levels of VA. If you're with the highest level of TRICARE, that means you've worked for more than 20 years, you've retired from the military, and they give you full TRICARE, so you get all your doctors and all your medication from the VA, and they pay for everything. There is no reason to have Part B. You're pretty much wasting your money on Part B because TRICARE pays for everything already. And if you sign up for a Medicare Advantage plan, it messes up your TRICARE. I had one lady that kept getting copays and kept getting bills, and there was no reason for it. And the reason why is because she had a regular Medicare Advantage plan. We just dropped the plan, we dropped her Part B, and now she gets everything through VA, everything through TRICARE. They really take care of the veterans that have the TRICARE. So there's no reason to have Part B for that. So some of the mistakes that people make are, if you've already taken your Social Security before you're 65, like you can start taking it at 62, Social Security will automatically enroll you in A and B, whether you work for a big employer, whether you have TRICARE or not, they will automatically enroll you. And a lot of people don't even realize that. They just know that their Social Security, they're getting a little less money. Well, and then they'll mail you a card. When you get that card in the mail, your A and B, your red, white, and blue Medicare card, flip it over. On the back side, you have about 100 days prior to when you turn 65 that card will come to you. You can write on the card and suspend your A and B. There's no reason to have that if you are working for a large employer, or you have TRICARE, or you've got federal employment health benefits. You can just rescind that and send that in. A lot of people forget to suspend it. So if you don't require the Part B, make sure when you get that card in the mail that you send it back in. You also, a lot of people just sign up for A and B because they think they need to. They don't really understand what it's about. If you do that and you realize that you really don't need that, you're working for a large employer, there's a form called the 1763 form that you can get from the Social Security office, and it's a termination form. So it terminates the Part A and B. You can keep A, it doesn't cost you anything for that, but you just get that form from your local Social Security office, fill it out, give it to them, and they will terminate your Part B for you. Now, there's some ways to save on Part B as well. There's a Medicare savings program that you can apply for. You go to ssa.gov and look for up top, it'll say Medicare, and then it says Part D Extra Help. Click on that. Click on apply online. It's very easy to do. They'll let you know within 3 to 5 days. If you apply online, they'll help you with your Part D. Think of D as drugs. And a lot of times they'll pay for your Part B, B as in boy, that $174.70 per month. So you can apply online at ssa.gov or go into the Social Security office. The next is Medicaid has programs. If you're making under about $1,200 a month, take home in your household, apply for Medicaid. And you do that through health and welfare. And if you do that, if you get either Part D extra help or you apply for Medicaid and get that, call me and let me know, because we can get you some extra programs that coordinate your Medicare, Medicaid together, and they'll give you all kinds of transportation benefits, over-the-counter benefits, sometimes food benefits. They pay for everything. So there's some really good programs that are state coordinated programs for Medicaid and Medicare. The other thing that you want to look at, if you're going, say you're 62, 63, and you're aging into 65, is your IRMA. IRMA is Income Related Monthly Adjustment. It goes back 2 years. So Part B, if you're making under about $103,000 per individual, $206 per household in 2024. If you make more than that, they're going to charge you more for Part B. It's called IRMA. So you can actually set up with your financial advisor to work with making a little less money so you don't have a higher IRMA or a higher Part B coverage. Does that make sense? So check in with your financial advisor. If you're making more than $103,000 or $206 together as a couple, you may be paying more for Part B. And then the last way to save some money on Part B is if you're VA has some policies that are Part B give back. So that $174.70, they'll give you a portion of that back. So there's 2 different programs that you can sign up for. One's with United Healthcare, one's with Humana, that can give you a portion of that, if not all of that, back each month if you have veterans benefits. So I trust that helped you today. Let me put my phone number up here one more time. If you want to get in touch with me, you can. We're not going to be here next week, but we will be here back in the middle of September. And again, these are all recorded. You can go right into YouTube and look at the recordings. They're under live events. Also, I make sure that most of this information is also on the website Insurance Over 65. Thank you for coming today. Thank you for watching, and have a wonderful weekend. Look forward to seeing you again. Bye-bye.